Imagine having constant pain and fatigue no matter how much rest you get. This is the reality for those suffering from fibromyalgia, a chronic disorder that's not just a simple ache or tiredness. Picture a world where your muscles throb with pain, your body screams with fatigue, and localized areas feel sensitive to the slightest touch. This isn't a rare occurrence, but an everyday ordeal. Fibromyalgia disrupts lives, turning simple daily tasks into insurmountable challenges, while sleep, a sanctuary for most, becomes a battleground as restful nights are elusive. It's a condition that can be as perplexing as it is painful. Fibromyalgia can be quite debilitating, but how do doctors view this condition? Healthcare professionals approach fibromyalgia from a clinical perspective. Indeed, the journey to a fibromyalgia diagnosis is often a complex one. Doctors must first rule out other potential causes of the pain, which can be a lengthy process given the myriad of conditions that share similar symptoms. The challenge is amplified by the fact that there's no definitive test for fibromyalgia. Diagnosis is typically based on a patient's history, physical examination, and sometimes blood tests to exclude other medical conditions. It's like piecing together a puzzle with no clear image to guide you. Once diagnosed, the doctor's role is to help manage the symptoms. Treatments often include a combination of medication, exercise, stress management techniques, and healthy lifestyle habits. The aim is to reduce pain, improve sleep, and manage fatigue. Yet, it's important to remember that this clinical perspective only paints part of the picture. While doctors focus on managing symptoms, patients often have a different perspective on living with fibromyalgia. Living with fibromyalgia is a daily battle for patients. Each day is a new confrontation with constant pain and fatigue, an invisible enemy that can seem relentless. This continuous struggle can often lead to feelings of frustration and depression as the physical discomfort becomes an emotional burden. Fibromyalgia, being an invisible illness, poses another challenge. Patients often feel misunderstood, as the severity of their pain isn't always apparent to others. Imagine having a constant nagging ache, but to the world outside you seem perfectly fine. Despite these challenges, patients find ways to manage their symptoms. Some explore alternative treatments like acupuncture, yoga, or dietary changes, while others find solace in support groups where they can connect with others who truly understand their experience. Though the experiences of doctors and patients differ, the goal is the same: to improve the quality of life for those living with fibromyalgia. Fibromyalgia is a complex condition that requires a comprehensive approach. Remember, appreciating both the clinical and personal aspects of the illness is crucial to enhancing patient care. As we continue to learn more about fibromyalgia, we move closer to finding more effective treatments and ultimately a cure.